Hey guys, welcome back to the Pulling Curls podcast. Today on episode 255, we are talking about why you should take a hospital tour. So let's untangle it.
Hi, I'm Hilary, a serial overcomplicator. I'm also a nurse, mom to three, and the curly head behind Pulling Curls and the Pregnancy Nurse. This podcast aims to help us stop overcomplicating things and remember how much easier it is to keep things simple. Let's smooth out those snarls with Pregnancy and Parenting Untangled, the Pulling Curls podcast.
This episode of the Pulling Curls podcast is sponsored by the online prenatal class for couples. Beyond getting to know your hospital, there's lots of things that you can learn on your own timeline at home. And I recommend the online prenatal class for couples. It is the easy way to get prepared for birth. Remember, it is taught by an expert. It only takes 3 hours and it is available 24/7. So if you want to join me at 10 p.m. on a Sunday night, let's do it. Come join me. One of the biggest myths I hear is that people think they have to take the hospital birth class in order to take the hospital tour. And that is not true at all. The hospital uses these hospital tours as a marketing method to help you pick which hospital is right for you, hopefully their hospital. So they are available for anyone to take. Now, since COVID, a lot of hospitals have changed to just doing them virtually. Sometimes they have a nurse there that can answer questions after they show you like a video, or sometimes it's just a video. Whatever your hospital is going to do, try and do it. You know, if it's a video tour, if it's just an online website that tells you some of their policies, do it. Hopefully they have something. And I know lots of hospitals are starting to do in-person tours, and I think it is worth your time. I know it is a pain to get to the hospital, find parking, do the tour, but I would recommend doing it. Okay, so what are the benefits of doing a hospital tour? First off, it is a dry run at driving to the hospital. Hopefully you are taking this tour together, but your partner can understand how to get to the hospital, where to park, all those different kinds of things. It's just nice to have that done if it's not in an area that you frequent often. I know a lot of people live a long way from their hospital, so that is an extra thing. Hopefully you could schedule this tour maybe when you're seeing a provider or something by the hospital. I will say that our hospital would even provide like impromptu if your provider knew you wanted a hospital tour, if they called the hospital and said, hey, Heather would love a hospital tour. Is there anyone that can give it to her in the next half an hour? Sometimes we would be able to accommodate that, and you could even get a private tour. So that's something to think about as well. Okay, the other thing is to think about what amenities your hospital have. And when I say that, it sounds like I'm talking about a hotel, right? Is there a country club? No. But some hospitals have like a fridge in the room that you can bring food and put food in. My hospital didn't have that, so just FYI. Some have special lighting. Some have a tub in every room. Some provide specific things for the mom, special hospital gowns or whatever. But knowing the amenities that are standard in your hospital can help you know what you should be bringing, right? If you want a specific lighting in your room and the hospital has fancy lighting, then you know that it's something you don't have to pack. Or if you want special lighting in the room and all of it is horrible fluorescent bulbs, you know that that's a priority for you, right? And you can ask at the hospital tour if that's even possible, because some hospitals are really reticent to allow you to plug things in that could be a fire hazard. So these are good things to ask. Every hospital is super different and weird about those kind of things as well. Your hospital tour is a great time to find out what they recommend you bringing in from home. A lot of people think that the hospital provides toiletries, and we do. I mean, I don't know why they label it as lotion, but we have a bottle of what is labeled as lotion, but it is like white water. It doesn't even do anything. So I always recommended be sure if you want to be able to shampoo, conditioner, use lotion. You know, we had a bar of soap for you. So as long as you're not super picky about that, that would work. But I was really clear on what I would be willing to take from the hospital versus what you should bring. And at the same point in time, I would say we have mesh panties. You don't need to worry about bringing panties from home unless you think that'll make you more comfortable. And I should do a note that I did a ton of hospital tours because I really enjoyed talking with these patients. And so they always knew that I was willing to go give the tour when the provider would call and say, can Heather have a hospital tour in 15 minutes, right? Not every nurse is up for this, but I love chitty-chatting with patients, which is why I'm the pregnancy nurse. It also gives you a time to get a feel for the unit and kind of where in the hospital you'll be. You might look at the hospital and be like, well, I'm going to give birth there. But hospitals, once you get inside, are really big. Is it on the top floor? Is it on the bottom floor? Is it in a separate area? The last hospital I worked for was actually not in the main hospital building. We had to walk across the street to take our labs to the hospital because we were a freestanding birth center, even though we were still affiliated with a hospital. And if we called a code, those nurses came from the ICU, ran across the street to us. So it's really important that you understand like where in the hospital you're going to be. And I think it just gives you peace of mind knowing, okay, I'm going to have my baby on the third floor, right? Also, it's going to give you an idea. Do you stay in the same room after you have your baby, or do you transfer to a postpartum floor that's on a completely different floor? And it gives your partner an idea of how that transition is going to work as well, because it can catch them off guard if they leave you after labor and delivery to go grab you a sandwich because, hello, deli meat. And then they come and you're not in the room. They're like, oh my gosh, what happened to my wife? Oh, she got transferred to postpartum. But if they already know in advance she's going to get transferred to postpartum, then they just know, and it decreases anxiety and things like that. I think it's really important to have a list of questions that you can ask on your hospital tour about what's important to you. And that's going to vary person to person. You can't ask things about like your specific medical circumstances, but let me give you some that I kind of thought of. One of them is, how many patients do nurses usually have? I will say that a lot of hospitals, nurses have 2 patients, mostly up until the patient is pushing. Some hospitals, they only have 1 patient throughout. It really, really depends. And so I think that's a valid and important question to ask so that you can understand how much support you're probably going to get from your nurse while you're in labor. Of course, these are not hard and fast rules. There are times that I've had 4 patients, one of them possibly delivering in the hallway because that's how labor and delivery goes. And there's times where we only have 1 patient on the unit and we all just dote on her because we have nothing else to do. So it really just depends on who's coming in, but it just gives you an idea of how busy the hospital is in general. I think it's a great one to ask them, how often do you have births that fill in the blank, go natural, deliver on their back, ask for extra long cord clamping, whatever is important to you. Do you ever deliver patients standing, things like that? Now, a lot of those are really going to depend on your provider, usually your doctor, but it does give you an idea of the birth culture on the unit. If the nurse who's giving the tour is like, no, we really don't deliver too many patients standing. And if I was giving the tour on that, I would be like, that's something I would talk with your provider about at your appointments. As nurses, we can always facilitate that because honestly, we're not the ones on the floor delivering the baby, and we don't hold any of the liability for that type of thing. So that is something you'd want to talk with your provider. But usually on the tour, they're really good about saying that's something you're going to want to talk with your provider about. But again, these are good things to ask at the hospital tour because maybe they're going to say, yeah, we deliver people squatting all the time. And then you'll know. Another good one that I think you can ask is, what's something that surprises a lot of patients delivering here? If I was answering for my last hospital, I would have said it is a hidden gem in the valley. So few people know that we even exist. We end up giving great care. But other ones, it would have been like, we ask you for money at the bedside to do your hospital binder. I probably wouldn't have said that in the tour because I probably would have gotten in trouble. But just ask them just some questions like that so that you start to get a vibe or some idea of things that you might want to bring or expectations you can set for your own delivery. As a reminder, as I just said, these are PR tours for the hospital. So we're trying to bend over backwards, show you that you're going to have a great delivery here. And they're trying to spin things in a very positive way for the most part. I mean, we are nurses, so we're probably going to be pretty honest. Although a lot of our tours were given by our unit secretary, the person that like ordered pencils and pens for us. So she probably spun things nicer than the nurses did. And a lot of people are like, oh, I should take this hospital tour at 35 weeks. I had people taking a hospital tour who were still trying to decide what doctor they were going to go to. So don't feel like you have to do the hospital tour right before delivery. A lot of people are looking at a couple different hospitals and they want to take the tour. And then they kind of pick their provider based off of the hospital tours. So don't feel like you can only do it once you're close to your delivery date. However, if you know that you're going to XYZ hospital because it's the one you're going to go to, I would recommend doing the hospital tour after about 25 weeks so that it's not too far in advance of when you'll actually deliver. Because some hospitals have certain policies that kick in during cold and flu season, or if the parking lot is snowed in, they have specific areas where they want labor and delivery to park because the hospital parking lot gets smaller because of all the snow. So there's things like that to think of, that going a little closer to due date is handy. And one thing that I think a lot of people don't think about is I actually did a sibling tour with my son when I had my second baby. And if your hospital offers something like that, I think it can be really nice. It was nice for him to know where I was going to have the baby. And it wasn't as surprising when he came to visit me because he had seen that unit before. So there was a lot less catching him off guard when he came to see me after we had the baby. And it also gave us a time to talk that the baby was going to come and all those kind of different things. So if your hospital offers a sibling class, I would recommend it, or at least call and find out what they talk about in there. My son got to wear like a little hat and the little boot covers. It was really fun. We had a good time doing it together. So, as you can see, I do recommend taking a hospital tour. If you guys have questions, come find me over on Instagram. I would love to chitty chat about what to expect at your hospital tour. Or if they said something specific on your hospital tour that had you kind of with a question mark over your head, tell me on Instagram and I can kind of interpret that and give you some ideas about what it might mean for your birth. Stay tuned. Next week, we have a social worker coming on to talk about postpartum anxiety, so stay tuned.
Thanks for joining us on the Pulling Curls podcast today. If you liked today's episode, please consider reviewing, sharing, subscribing. It really helps our podcast grow. Thank you.